Hello everyone, this is Shalini Kumar again from ONTC. I'm an experienced OSCE nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE nurse training Cambridge. In today's video, I will be covering one of your other clinical skills. So if you like my videos, please press the like button now and subscribe to my channel. So, in today's video, we're going to be talking about the peak flow reading. Peak flow meter reading, which is one of your clinical skills in your NMC OSCE exam. So it's called PEF reading, which is peak expiratory flow rate reading. Okay, so we're going to be talking about that today. I'm going to show you how to do, I'm going to talk you through how to do the station and also show you what's in the marking criteria, and of course at the end my top tips. Okay, so let's talk about the PEF reading, peak expiratory flow reading then. So it's your 8-minute station in your exam, and they have changed the marking criteria recently a little bit for this station. So I'm just going to be showing you according to the latest, the new marking criteria, which is on the test centers, and I've also attached the copy to the description of this video below. So it's your 8-minute station. You have to take 3 peak flow readings with your patient. Your equipment, they tell you, is already clean and ready to use, and then you're going to document all 3 readings and also the final reading. Now final reading is the highest of the 3 readings. Okay, so that's your final reading, which should be recorded on your document, which they give you the recording chart. Okay, so coming to the recording chart, so I want to show you what it looks like. So that's on the next screen. So there is a space for your scenario, and then your patient details there, any allergy status, and then you got 5 columns there for 5 readings, but you're not going to do 5. They only ask you to do 3 readings in your exam. So you're going to do reading 1, reading 2, reading 3, and the final reading column, in that column you're going to add the highest of the 3 reading is your final reading. Okay, so I will show you how a copy of the completed one at the end of this station. Okay, so let's get started. So what is our step-to-step procedure? So obviously, with any station, the scene safety, draw the curtain, and then you're going to obviously do the ID check and allergics check against your documentation. Now in some time your assessor will tell you that this has already been completed in your briefing, so you can assume that you have already done it. So if you have already done it, just say, as per my briefing, my ID check and allergy check has been already done. If not, then go ahead and do that against your documentation. Okay, so just ask your patient for details and check it against your document. If they're wearing a name ban, allergy ban, check that as well against your document. Okay, so that's so your ID and allergy check is complete. Now you're going to obviously inform your patient that you're here to do their peak flow reading, which checks your lung capacity. So is it okay if you go ahead and do that? That's informed consent. And after that, you're going to clean your hands as per WHO guidelines, and don some non-sterile, just clean gloves, normal clean gloves and an apron. And then you're going to prepare all your equipment. So what you're going to do is that you're going to first make sure that your patient, which is normally a mannequin in your exam, so they normally don't give you a real person to do this station, so it's normally a mannequin, and your examiner will be the voice of the mannequin. So make sure your mannequin is in upright position, because we should be doing peak flow reading in an upright position. Okay, so next is you're going to attach a disposable, so it's like a cardboard disposable mouthpieces you will be given. So you will take one of the mouthpieces, disposable ones, and attach to your peak flow meter. Okay, so you will do that. So you will attach to your peak flow meter, and now you need to make sure, before you start explaining to the patient and start doing a peak flow reading, make sure your needle on the gauge is pushed down to 0. Okay, so your needle on the peak flow meter is pushed down to the 0. Okay, so once you have done that, then you're going to explain to your patient how to do it. Then we're going to go ahead and do the 3 readings. So once the needle is pushed down to 0, then you're going to ask the patient to take a make sure they hold the peak flow meter in a horizontal position. Okay, and also make sure that the patient fingers do not obstruct the needle, okay? Otherwise needle won't be able to move if they put fingers on the top of the needle. So that's another thing. So hold it horizontally and make sure the fingers do not obstruct the pointer. And then the next thing will be, ask your patient to take a deep breath in through mouth to full inspiration. So deep breath in through the mouth to full inspiration, and then ask the patient to place their lips tightly around the mouthpiece, immediately obtaining a tight seal. Okay, once they got a tight seal, then you're going to ask the patient to blow out through the meter in a short sharp huff as forcefully as your patient can, because you want them to blow into the peak flow meter in one blow. Okay, and that should move your pointer and give you a reading. So once you have given the instruction and your patient has done the first reading, your assessor, obviously mannequin can't blow into the peak flow meter, so assessor will tell you, assume your first reading is done, and they will give you your first reading to put on your chart. So go ahead and straight away document the first reading. Then you're going to repeat the procedure another 2 times. So second time again, make sure you bring the needle on the gauge back to 0 again. Give your patient few seconds to just have it rest. And then you're going to say the same thing again. Hold the peak flow meter horizontally, take a full breath in through the mouth to full inspiration, make a tight seal around the mouthpiece, and blow in a short sharp huff as forcefully as your patient can. So that will be your second reading. Assessor will give you the second reading, and then you will plot that on your chart. And then again, bring the pointer to 0, bring the needle back to 0 on the gauge, and then make sure that you just repeat the instruction to your patient again, and your patient has had few seconds of rest between the readings. And then as long as your patient is okay and happy to do third reading, go ahead and again remind the patient again to take a deep breath into full inspiration, and then make a tight seal around the mouthpiece and blow as hard as fast in a short sharp huff again. Okay, so that will give you your third reading. So plot that. So your assessor will give you your third reading and then write that. So now you got your 3 readings. Straight away figure out which one is your highest reading, and then add to that final reading column. So that's your final reading. Make sure that you print your name and your signature and the date on the form, because that's required to pass, to complete all your documentation. And once you have done that, then you're going to take the mouthpiece off, the disposable mouthpiece off, and put that into clinical waste. And then you can verbalize that you will clean your tray with a wipe and get it ready for next use. So you can just verbalize that bit, but make sure you do take the mouthpiece off and put that in clinical waste, okay? And verbalize that you will clean your tray ready to be used next time. Then you can take your gloves off, clean your hand, and then take your apron off and do your final hand hygiene. So that will be the end of your station. So on the next screen now, I'm going to show you a copy of the completed form. So you can see you got 3 readings in first 3 columns and the highest one in the last column. So that is your highest reading, and you print your name and signature and the date. So that's really important. And so that completes your document. So now my 5 top tips. So the top tips are, it is quite quick station, 8 minutes do go very quickly, so make sure you practice with a timer. Top tip number 2, verbalize everything very, very clearly, because your mannequin can't do a reading, so your assessor is relying that you can do this procedure correctly. They're relying on your verbalization, okay? So can you verbalize it correctly, all your steps? So that's really important. Be clear and verbalize everything clearly. Tip number 3 is learn your steps, how to perform a peak flow reading, because sometimes I see that if you try to do rote learning, then you can mix up the steps. So make sure you have read the marking criteria, make sure you know step by step how to do the peak flow reading and how to explain that to your patient, okay? So that's really, really important. Tip number 4 is your documentation. Make sure you do not forget to complete your documentation. Sometimes you put your 3 readings and you forget to add the final reading. That's really important that you add the final reading. Tip number 5 is do not forget to print your name, signature and the date. So that's really important, because lots of fails happen on sometime, like just simple mistakes like that. So these were my 5 top tips for this station. I hope you like the video and it will help you to prepare for your peak flow reading clinical skill in your exam. And if you like the video, please press the like button now and subscribe to my channel. You can also visit us on OSCEnurstraining.com, and I soon will be back with another video for you. So bye for now and thank you.